Welcome to Countyline, the public access television program featuring news and information about Allen County government. I'm Mike Green, the Public Information Officer in the Allen County Commissioner's Office, and we are standing outside the brand new Fort Wayne Allen County Department of Health Medical Annex. It is located, as you can see, at 4813 New Haven Avenue, just outside city limits of New Haven. This facility began operating in May. 3 of the health department's clinics are now located in this 17,000 square foot facility. That means more efficient services being provided and also more flexibility for the health department staff. Now, as I said, this facility began operating in May, but on June 21st, it was officially dedicated during ceremonies here.
And commissioners, members of the council, members of the board, Commissioner McMahon, Mindy, job well done. We're very proud on behalf of Dr. Greg Larkin, State Health Commissioner. We share how proud we are of what's happening and the accomplishments in Allen County. There are no shortages of public health issues in Indiana, to quote an old friend of mine and mentor and colleague. Certainly this facility is well prepared to deal with those. The residents of Allen County can now have a lot of, while we're celebrating this building, we're actually celebrating potential, because the potential is here to do so many good things for the residents of Allen County, and we're very proud of the accomplishments of this health department.
And important things happen in every type of building, but my bias is that medical facilities are a little special. While we certainly have routine types of visits, for example, childhood vaccinations, although I don't know if the children or the nurses would think that's routine, but we also have very important events that will take place in this building. For our new refugees, this will be their first experience with the American healthcare system. TB patients who receive their care here are very ill and need a lot of personal care and attention during those first 2 months of treatment. And some patients that will be sitting in our exam rooms will hear for the first time that they have an incurable disease. I'm truly grateful that we now have a medical facility that reflects the significance of the events that will occur here. I'm also grateful that our facility now mirrors the excellent care that is provided by our stellar staff. But this is more than about creating just a top-notch medical clinic. It was about creating a facility that allowed for the alignment of our most precious resource, our staff, in such a way that we could begin our journey to become a center of excellence for clinical public health. Our goal is that within the next 5 years or sooner, even greater things will be happening in this building.
Mindy Waldron is the administrator for the Fort Wayne Allen County Department of Health, and the person who is mainly responsible for getting all this together. She had a lot of work, she'll admit to that, but congratulations first of all.
Thank you very much. We're very excited.
Tell us, what's the biggest thing that's going to come out of having the 3 clinics located now in this one facility?
I think there's actually 2 things, and one internal, one external. External is it's just so much more convenient, safe, private for the clients. And for us, we're actually able to staff share and a little bit more of the internal efficiencies is I think what we'll see as the bigger benefit.
Mindy's going to take us through for a little mini tour of the facilities. We're in the main entrance lobby area.
Yes, this side is the entry area for immunizations, for our childhood immunizations and our refugee screening area. And so folks wait here and do their check-in prior to going for screening and or vaccinations.
And another thing that's nice is you've got plenty of parking, plenty of free parking.
Free parking, yes, and like you say, convenient parking. So we're very excited about that as well.
Okay, we're going to head now to one of the exam rooms. We're in one of the examination rooms now. How many of these do you have?
We have 3 exam rooms, and we're able to quickly move people through. We've moved to an appointment system, so it's kind of relatively efficient to be able to see people in here, not just for refugee screening, for vaccinations, but also for our new lead clinic. So we have 3 exam rooms, relatively similar to this one.
Okay, and let's talk about, we haven't really mentioned the clinics that are going to be located here.
Well, currently we have our STD clinic, which is, you'll see that here in just a bit, and our HIV, STD prevention. Those are our counseling folks, our education folks for STDs. And then we have our TB or our infectious disease clinic as well. This side, and main focus is over here, are our childhood vaccinations and then all of our refugee screening. We are starting a new clinic with regards to lead, and that will start here soon. That's for preventing childhood lead poisoning.
Now, how much of the equipment were you able to bring over from your other facilities?
Most everything we had made the move. The only thing that we had to purchase were things like new chairs, some of those things, or new cabinetry, which was adhered to the walls at our other location. But all of the furniture and true medical equipment, most of it came with us.
Okay, let's take a look at some of the other things we've got here. Now we're in one of the, well, the lab that you have here. And again, most of this equipment was brought over from, you were on the 5th floor with the lab there.
Right. We do have a significantly smaller lab than we did, but we are doing less testing than we did. I do think we wish we would have sized this a bit larger, but we brought most everything you see in this room came with us from the other location. And what the folks do is sometimes we do in-room testing on some of the patients depending on what the test is, but some things need to be sent out or have further testing or spun down or whatever the case may be. And so we do have a facility to do it, as well as package things for shipment to other labs, reading a lot of results and saving them here, as well as some other exam type issues take place in this lab. We have a couple staff that operate out of the lab from their offices as well.
Okay. And now we're off to another section of the facility. Now we're in an area that's called the charting room. I assume you have charts in here.
That is correct. Previously, we would have to chart in a small office or in the hallway or standing for the doctors and nurses. So this is a combined area where all of the medical staff that are seeing patients after they see them or prior to can chart their medical records into our electronic medical record and chat about client issues, as well as we have complete access over to our, of course it won't work while I'm on the camera, but we can get all files from our registration area as a quick pass-through. And this whole area on the other side of this window and all of the exam rooms and waiting room on that side are protected with our negative airflow. So if we have an infectious TB client, they are not going to be able to spread that because it has such quick air replacements. So that's a huge benefit to this building as well.
It looks like you have room for about 8 or 9 people in here.
Right. There are 11 stations in here, with the exception of this one's a bit smaller, and they're all occupied by our nurses, medical assistants, and doctors.
And that, again, is a matter of being able to provide more efficient service
Right.
to the folks that show up here.
Right. And again, a safe and a private area to do charting versus discussing client care in the hallway. So this is just more efficient, a little bit safer and more private, as well as something that's a little bit better of a setup and a flow for all the medical staff.
Okay. Now we're heading downstairs. We're down now in the basement area where you have facilities for staff members. We're in what is the large conference room downstairs.
Right. We're very happy that we have 2 conference rooms now. We have a small one where we have meetings or we can have discussions on case conferences. And then we have a large conference room, the one that you see here, where we can do training. And something to point out, it's a huge benefit that came by way of a grant. We were able to add equipment for video conferencing for all 3 of our locations. Because, as you know, we have 30 staff that still reside at the City County building, and we have a vector control office. Previously, you'd all have to gather in one spot and all of that type of thing. So this just adds to one of the benefits of having this as somewhat of our medical headquarters, and yet it's linked to all of our other staff as well.
And as you mentioned, and we should emphasize, you will still have offices located, well, for now at least, in the City County building, perhaps moving, but you will still have a presence downtown, and there will be some services people will need to go downtown to access.
Absolutely, and so that's the big clarifying thing about this whole project is roughly 30 of our staff are in this building, and they're our medical staff. The rest of our staff, environmental protection, our inspectional staff, food, hotel, motel, swimming, pollution, our vital record staff, and our admin staff are all still located in the City County building. And as I said earlier, our vector control staff, or our rodent control and mosquito control, are still located off of Carroll Road. So we have 3 locations, 30 here, 30 downtown.
I know this is something that the Department of Health has been looking at doing for a while. Circumstances presented the ability to locate out here. This has got to be just a great feeling for you and your staff. Right,
and I mean, after 3 years of talking about where could we do this, is there funding for it, it's an important project, to see it come to fruition is just a huge proud moment for Dr. McMahon and myself, but for me specifically, because we got it done, I think in the worst funding time there was, seeing it as a worthy project. So not only do we have, like I said before, internal and external efficiencies, but we got it done under budget, and it's a great facility and a reuse of a facility that would have probably otherwise maybe gone unused for a period of time.
Win, win, win all the way around. Right. Mindy, thank you so much for joining us. We appreciate you taking us around, and we hope folks have the opportunity to come by and at least see the facility, and if they need to, use it.
And we thank you for highlighting it. Appreciate that.
No problem.